Hello everyone, welcome to my YouTube channel N-Gurukul. Today we will see the blood bank. So, a blood bank is a medical facility that store and distribute blood and blood products to hospital and medical center for use in the blood transfusion and other medical procedures. It is responsible for collecting, testing, processing and distributing blood and blood products to ensure their safety and efficiency for patients. Some questions are related to the blood bank, so we will see one by one. So first question is, who started blood banking? An eminent pioneer in the field was Charles Richard Drew, whose work on the banking of blood products and the logistic of collecting and distributing blood saved countless lives in the trenches of World War II and the wards of military and the civilian hospitals. Second question is, why is it called a blood bank? In 1937, Bernard Fantis, director of therapeutic at the Cook County Hospital in Chicago, establishes one of the first hospital blood banks in the United States. In creating a hospital laboratory that preserved, refrigerated, and stored donor blood, Fantis originated the term blood. Third question is, what does blood bank do? A blood bank collects, separates, tests and stores blood until a patient needs it. If you have donated blood before you have been part of the blood banking process, the first blood bank in the United States was established in 1937 by Dr. Bernard Fantis at Cook County Hospital in Chicago. Fourth question is, what is the principle of blood banking? The discipline of transfusion medicine, that is also known as the blood banking, includes the collection, testing, processing and preparation of blood and blood components. Second, the selection of the most appropriate products and transfusion practice based on laboratory finding and the patient need. Fifth question is, what are different type of blood banks? So see, list of licensed book bank in India. There are three kind of blood banks. First is government, second one is private, and third those who run by the NGOs, that's the non-governmental organizations. Sixth question is, which is the biggest blood bank in India? Rotary Blood Bank. Rotary Blood Bank is India's largest blood bank located in Tughlakabad Institutional Area, New Delhi, India. Seventh question is, who control blood bank in India? So presently the NBTC, that's the National Blood Transfusion Council, is housed within NACO, that's the National AIDS Control Organization, and functions through resources available with the Blood Transfusion Service Division. 25th meeting of the governing body of NBTC have been held and important policy decisions have been taken pertaining to blood transfusion services. Eighth question is, which is the first blood bank in India? The first recorded of the voluntarily blood donating initiative in India can be traced back to 1942 during the time of World War II, when the first blood bank was established in Kolkata, that's in West Bengal. The blood bank was set up at the time to fulfill the blood needs to those who injured in the battlefield. Ninth question in, how many blood banks are there in India? So answer is, there are 3840, means 3840 licensed blood banks or the blood centers in the country, means India. The detail of government and private licensed book bank in the country will be given in the analysis A. So last question is, which country has first used blood bank? So world first hospital blood bank was established on March 15 in Cook County Hospital of Chicago, that's the USA. India's first blood bank was set up in the School of Tropical Medicine in Kolkata, or we can say the Calcutta, by Sir Upendranath Brahmachari, then the chairman of West Bengal Red Cross Society. Make sure to subscribe my channel. Thank you. Have a great day.